माशाल्लाह फिरदौस अहमद। आज हम पढ़ने जा रहे हैं फुट एंड माउथ डिजीज़। Foot and mouth disease, sometimes called hoof and mouth disease, is a highly contagious acute disease of all cloven-footed animals caused by amphibovirus, caused by fever and vesicular eruption in the mouth and on the feet. Resistance to physical and chemical action, temperature inactivity by temperature above previous centigrade, pH inactivity by pH is greater than 6.0 or less than 9.0. Disinfectant inactivity by sodium hydroxide 2%, sodium carbonate 4%, and citric acid 0.2%. Sensitive to environmental influence such as sunlight and desiccation, survives for a long period at freezing temperature. Epidemiology, geographical distribution, endemic, Asia, Africa, the Middle East, South America, and Europe. Currently, the OIE recognizes countries to be in 3 disease states in regard to foot and mouth disease. Foot and mouth disease presented with or without vaccination, foot and mouth disease free with vaccination, and FMD free without vaccination. Source of virus in incubating in clinically affected animals breathe saliva, face and urine, milk and semen up to 4 days before clinical signs. Meat and byproducts in which pH has remained above 6.0. Carriers animals, particularly cattle and water buffalo, recovered cattle by carriers for 18 to 24 months, sheep for 1 to 2 months. Transmission, direct or indirect contact, mainly by inhalation, also from ingestion, artificial insemination, etc. Vectors animate humans, pigs, birds, etc. Animate vector vehicle implement highly contagious, spread over greater distances with the movement of infected or contaminated animals, products, objects, and people. Clinical findings: incubation period up to 2 to 21 days, average 3 to 8 days. Initial signs: fever 1.103 to 105 Fahrenheit, dullness, anorexia, shivering, reduction of milk production for 2 to 3 days. Continued tongue vesicles, ruptured vesicles in dental pads, lesions in leg, mouth, and dental pad. Signs in sheep and goats: lesions are less pronounced. Foot lesions may go unrecognized. Lesions in dental pad of sheep, agalactia. Diagnosed history: clinical signs: fever, dullness, vesical erosion, abortion, etc. Collection of sample specimens: oral, nasal, foot, or memory lesions are good source of specimens. Vesicular fluids: epithelium covering of vesicle 0.5 grams, about 5 ml of blood with anticoagulant. Esophageal, pharyngeal fluid. Treatment: washing the affected area with mild disinfectant 2% caustic soda, 4% ash, and 2% acetic acid. Apply antibiotic locally. FMD cure for POW care. Protective dressing in infected areas or prevent secondary infection. Sulfadimidine or broad spectrum antibodies injections are useful to the secondary bacterial infection. A good systematic response is reported to the administration of fluximine. Fly repellent must be used. Traders name: angidiodine and renomycin 33 grams, sulfadamide 5 to 30 grams per kg. Intramuscular IC/IV half dose from 2 days 30 to 100 ml Renata, 5 to 100 mg oxytetracycline, 5 to 10 mg of kilograms. Intramuscular intravenous 10 ml of vial or Renata. Prevention: export restrictions should be imposed on countries with known outbreaks. Quarantine and movement restrictions. Euthanasia at affected animals. Cleaning and disinfection of affected premises, equipment, and vehicles. Infected carcasses must be disposed safely by incineration, rendering, burial, or other techniques. Endemic regulations to protect animals for FMDV must closely match the serotypes and strain. Vaccination of one serotype does not protect the animal against other serotypes. Currently, there is no universal FMD vaccine. Thank you.